When you have a posteriorly rotated pelvis, then you are going to have overactive glutes and overactive hamstrings. So we're going to work on strengthening the psoas, strengthening the quads, and releasing the glutes and hamstrings. When you have a posterior tilt to your pelvis, have a limited lumbar curve, range of motion with the femur is actually inhibited both in extension and flexion. So if you lay on your stomach, you cannot extend the leg well because the muscles of the hamstrings and glutes are already in a tight, short position. So you will not have great range of motion in flexion, which is to bring your leg behind you, but you will also not have great range of motion in flexion because the pelvis is tilted back and you actually don't have the range in the hip socket to bring the muscles or to bring the legs up into flexion. So in a posterior tilt or flat back syndrome condition, you will not have great extension or flexion of the femur. There are a couple of exercises that I like to do with that, and that is a simple cobra pose, but it's important to pay attention to a few things or you will actually make your condition a little bit worse. Super simple. You're going to press your pubic bone into the floor and you're actually going to lengthen up your tailbone. That puts you into an anterior tilt. Place your palms right under your shoulders and you're going to press up into extension, but the thing to focus on is the pubic bone has to stay on the floor. You have to be tilting just a tiny bit of awareness of the tailbone up, and the pelvis stays on the floor. Keep your elbows in close, tight to your side. Pull your shoulders down away from your ears and really just pay attention to how the pelvis feels, how the low back feels in that position. So that's a great way to increase your ability to bring your pelvis back into a neutral position. Another thing that I like is a foundation training hip hinging exercise. If you stand with your feet shoulder width apart or a little bit wider, you want to parallel the outside edges of the feet, which means your feet are facing straight forward. They're not in external rotation, straight forward. Now, with this exercise, your spine does not change shape, except you want to do that same kind of thing where you are engaging your transverse abdominis to the pubic bone, and you're having a little bit, you kind of want to think of bringing your tailbone up behind you a little bit. You're going to unlock your knees and you're going to hinge your hips back. That's going to put you into an anterior tilt type position, which will help to counter the posterior tilt that you're in. Think of the pelvis as a bowl. If it tips forward, then it throws things out of alignment. And if it tips backwards, then it throws things out of alignment. So while we're doing these exercises, we're thinking of keeping that bowl of our pelvis in a neutral position. We want it stacked with the rib cage. So I like to do a pistol squat or a version thereof. Play with moving more weight from the back foot to transferring more weight to the front leg. And feel how that changes how you work your quads. Both are really great. Do 8 to 12 on both sides. Another one that I like is, so we're going to hold one leg up. You can also just set your heel on the floor for stability if you prefer. And this is a great way to build quads and also the psoas. Also a really great exercise for knowing how balanced you are and strong on one leg. It's really common for us not to be able to hold our weight on one leg or the other. And this is a great way to find out how stable you are side to side.